Once again, good morning to everyone. Now I request Dr. Santosh Kumar to give a welcome note.
Respected Kannan sir and everyone, once again good morning. We would like to extend a special welcome to our guest, Dr. Kannan Gopal sir, who will be speaking about execution and barriers of evidence-based practice. Before that, I request Ms. Leela Amruta and Ms. Padmini to give an introduction about our guest.
I feel immense pleasure to introduce our today's session co-speaker, Dr. Kannan Gopal, who completed his B.Pharm at CL Ved Mehta College of Pharmacy, Chennai, and won the Best Outgoing Student Award. Sir had done his M.Pharm at Madras Medical College and pursued his PhD from Sri Ramachandra University, Chennai, and procured professional diploma in clinical research from Catalyst Clinical Services, New Delhi. He had overall solid experience of 22 years in teaching and people management in pharmacy practice. Currently working as an adjunct faculty for distance and blended learning programs in Texila International Marketing Management, service providers for Texila American University, Guyana. As an effective team member of Pharmacy and Therapeutics Committee, contributed actively in the development of hospital formulary and its periodic revision, and in the accreditation process of JCI and NABH to improve patient safety and quality of healthcare in the tie-up hospitals associated with PharmD curriculum. Sir had effectively trained 10 PharmD students of University of Washington, USA as a part of student exchange program. Dr. Kannan Gopal initiated the development of indigenous computerized physician order entry database. As an active member of the Drugs and Poison Information Center, Sir had contributed in the processing of around 2,300 drugs and poisons information queries. He also worked as a chief editor of a periodical newsletter, Nexus. Dr. Gopal, as a coordinator for the refresher course for hospital pharmacists, provided continuing pharmacy education for 75 hospital pharmacists of Apollo hospitals. Sir published 43 research articles in the reputed national and international journals, presented 20 national and 3 international scientific paper presentations, and have been awarded Best Paper Presentation for 4 scientific papers. Reviewer in journals of pharmacy practice and pharmacology, successfully delivered 32 lectures on various topics on pharmacy practice organized by institutions in and around South India. Sir, now the session is all yours.
Kannan sir, please switch on your audio and video, sir. Yes, sir. You're visible, sir. Maybe your mic is on mute.
Okay, sir. Are you able to hear?
Sir. Yes, sir. We could hear you, sir.
Yes, sir.
So, can we go with your presentation, sir?
Yeah, sir. Can I?
Yes, sir. Please, sir.
Hi, good morning to you all. I'm not we can say very well conversant in Telugu, but let me take a brave attempt, okay? So, nenu bagunnanu, meeranta bagunnarani ఆశిస్తున్నాను. ఇప్పుడు మనం కాన్ఫరెన్స్ అంశం గురించి చర్చిద్దాం. నేను ఇప్పటి సిద్ధంగా ఉన్నాను. Are you all ready?
Yes, sir. Good to hear you from.
Are you all ready?
Yes, sir. We are all ready, sir. Very good to hear you. That.
Yeah. Okay.
Yes, sir.
Okay. So, can we start the session, sir?
Yes, sir. Please, sir.
Yeah, all right. 1 second, sir. Sir. Okay, now the topic of today's session is evidence-based practice, execution, barriers, and solutions.
Sir, sorry, sir. Your screen is not at shared, sir.
Okay, okay, sir.
Can you please share your PPT, sir?
1 second, sir. It's not shared, sir.
No, sir, it has not been shared.
Might be, I will again reload it or what?
Yes, sir, you can go with screen sharing and you can
The
go
link
with.
again. Can I go with the link again? Because
No.
now I'm seeing your. 1
No,
second,
now
sir.
you can go with screen sharing, sir.
1 second, sir. Sir. 1 second, sir. Yeah, now it is okay, sir.
Yes, sir. Yes, sir, it is okay, sir. You can go with PowerPoint mode.
Yeah.
If you're comfortable, you can on your video also, sir.
Is it okay now?
Yes, sir.
Video?
Your video is not. Yes, sir.
Sir.
It is now, sir. Yes, sir. Perfectly.
Yeah.
Right. Yes, sir. Now the session is over to you, sir.
Yeah, okay, sir. All right. So, good morning to you all. So, just a brief thing about my Telugu version. Okay. So, that's what I was saying. Nenu bagunnanu. Miranta bagunnarani ఆశిస్తున్నాను. ఇప్పుడు మనం కాన్ఫరెన్స్ అంశం గురించి కర్సిద్దాం. నేను ఇప్పుడు సిద్ధంగా ఉన్నాను. Hope you're all ready. Can we start the session?
Yes, sir.
Hi. Can I start?
Yes, sir.
Good. Okay, so I need some kind of loud noises in between interactive sessions, okay? So that we all can enjoy. Fine?
Yes, sir. Definitely.
All right. So now the topic of today's session is practice, which we call as EBP. And we are talking about the execution, barriers, and solutions, okay? Now, like what are the things which we are going to talk about here is, the first thing we'll talk about what is healthcare and what Lord Buddha and Mahatma Gandhi shared about the term health. See, Lord Buddha says that to keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear. While Mahatma Gandhi says that it is health that is real wealth and not pieces of gold and silver. So it's a golden statement, which is true even today, and it will stay true for generations together. So one thing about healthcare providers' health status. See, the healthcare providers' health and wellness can affect both patient care and the healthcare system. That means the healthcare providers also should remain or stay healthy. See, this evidence-based medicine in healthcare has become an inevitable tool, especially in the contemporary setting. Now, let's see what is the difference between EBM and EBP. See, they both are intermingly used nowadays, but let's see what is what, one by one. See, evidence-based medicine is a concept which came under the pioneering concept of David Sackett. Hope you would have come across somewhere, say in 1996. So as per his definitions, What does it state about? It is a conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individualized patients. Now everything is customized. So David Sackett, a pioneer, dreamt of this customized therapy in 1996 itself. So it should be highly appreciated, isn't it? So then we're talking about what is evidence-based practice. See, it is a systematic approach to clinical problem solving, which allows the integration of, we can say, three things like clinical expertise, we can say the scientific evidences and patient perspectives to provide high quality services and optimal drug therapy. See, the term EBM, as I said already, is used interchangeably with evidence-based patients, or we can say evidence-based healthcare. So hope you understood what is EBM and then what is EBP. And then we saw that EBM is nowadays interchangeably used. All right. All right. Now, what are the features of EBM? So it is like, we can say, is it a philosophical framework? Is it an evolving concept? Or is it a method of practice, or a quality improvement program, or a teaching tool, or is it potentially risky if used wrongly? I can say very well with confidence that all the above statements is very well true about evidence-based medicine, right? Now, what is the essential for EBM, or why EBM, to put it simply? See, you know, new evidences are constantly made. So they are constantly emerging, isn't it? And we frequently fail to acquire new evidences. Our clinical performance also deteriorates with time, which we call it as scientifically as slippery slope. So if we are not well versed with the trendy things, we are lost somewhere, we can say scientifically. Traditional CMEs fail to go beyond the sheer acquisition of knowledge. EBM encourages self-directed learning process, which should overcome all these above, we can say, shortcomings or disadvantages. So hope you understood why we need EBM, especially in this current scenario. Now coming to features of evidence-based therapy. See, it integrates three main things. What are they? Number one, best evidence. Number two, individual characteristics of the patient. Number three, individual clinical expertise. So these are the things which it integrates, where you can also facilitate a decision-making process resulting in customized optimal drug therapy. Hope you already remember in the last slides I've said Sackett DL is the pioneer of EBM concept. So now, what is the approach, how we are going to adopt or implement the EBM, so which we call it as Pico Approach. So now, what is Pico? P here stands for the description of the patient or problem, and I, the intervention, which is mainly to be considered, and then the C, the alternative to compare with the intervention. That means we are comparing the intervention therapy, which we are using now, with the, we can say, the golden standard therapy. And then finally the O, it stands for the outcome expected, what is expected from this intervention. So which is called now Pico approach. So this is the approach which we are implementing in EBM. One second. Yeah. Now, what is the thing? Now here we are talking about now the steps involved in EBM. So it's very easy to remember. I always say to the students, like in terms of, easy, I can say remembering things. See here how to remember. There are 5 A's. What are the 5 A's? Ask the answerable clinical question. Number 1, ask. Number 2, acquire. What should be acquired? The most relevant and best evidence to answer the question. Because now a problem has come. That means we must know how to acquire the most relevant and best evidence and to answer that problem or the particular question, clinical question. Then the third step is appraise. What here we are going to do? We are going to appraise the evidence critically for validity, relevance, and applicability. So the three things we have to first apply. Next things is we are going to, whatever the things which have appraised, we can apply this along with the critical, we can say the expertise and the patient's preferences and values. And finally, what we have to do is the last A, assess the effectiveness and efficiency of the previous, all those 4 steps which I have said, right? So they have to be now, because should be assessed, and we should seek ways to improve one's ability to ask, acquire, appraise, and apply. So this is the things, that is, we are talking about the 5 steps in EBM. Okay, now I said to you, like, acquire the most relevant and best evidence, isn't it? So what are the things which you're going to refer then? So here we can say it as like, we can talk about 3 things we can talk about. So like, first of all, like the major one on the top of the pyramid is we're talking about the meta-analysis, then the systemic review, and then we can say the critically appraised literature. All this will come under, you can say, critical appraisal. And then we have the experimental studies, like we can say randomized, we can say the control trials, and then the non-randomized control trials. Likewise, the other things which we are talking about, observation studies like cohort studies, then case series, etc. But top in this, we can say the pyramid, we can say is the, we can say talk about the critical appraisal. What are they? Meta-analysis, systemic review. Hope you understood now. In this slide, what we have seen, the 5 steps involved in EBM, and then we have talked about what are the hierarchy of evidences, wherein we are having top in the pyramid. What are they? Meta-analysis, systemic review, and critically appraised, we can say the literatures or the evidence-based practice guidelines. So this is very important, therapeutic guidelines. So for every, pathological conditions, we have some therapeutic guidelines set by reputed organizations, which we have to follow for optimal patient care. Now, coming to, already I said in the last slide, what is the, we can say the most top in that hierarchy, that is systematic reviews and meta-analysis. A brief thing about this. Anyway, we'll be hearing this later also in the next sessions also, but let me brief it out, like what is systematic reviews and meta-analysis. So what is now, we talk about systematic review. So we are having some steps. What are they? There should be some clearly formulated question, number 1. Number 2, there should be some methods to identify studies. And then we have to do some selecting studies. That is, we have to, of all the things, we have to finally select and then critically appraise. So these are some steps which we are going to adopt for systematic review. But wherein coming to meta-analysis, what is it? It implements statistical techniques in a systematic review. It's also a type of systematic review, but it integrates the results of many, many more studies. Say, for example, if you're, if you're evaluating the beta blockers, especially
Excuse me.
Excuse me, sir. You're muted, sir. Sir, please unmute. Excuse me, sir. You're muted, sir.
Your audio is been muted, sir. Sorry to disturb you. Your audio has been muted, sir. Can you please unmute, sir? Kannan, sir.
Yeah, now it is clear, sir. Audible?
It is clear, sir. It is clear, sir.
Audible?
Audible, sir. Audible, sir.
It is audible, right?
Yes, sir. It is audible, sir.
Yeah. Yes, sir. So now I am proceeding. All right. So in between, because it's online session, sometimes, we have to verify. So, all right. Now let me continue. Say EBM, we can say shortly as a poem. Why am I saying it as poem? Because it is patient-oriented evidence matter. So because it matters a lot to especially the healthcare providers, because if valid, it can revolutionize, we can say, the clinical practice. It can reduce greatly mortality and morbidity, and it can improve the quality of life. And finally, it can even enable patients to live longer or at least better. Say, for example, cancer chemotherapy or cancer patients, they can live, we can say, an extended life. So I can say evidence-based medicine is to be like a poem. That is patient-oriented evidence matter. So now let us discuss in few slides what are the advantages and disadvantages of EBM. So first, let us focus on advantages of EBM. See, it ensures high quality patient care. It helps us to follow a standard guideline and create clinical protocols in accordance with global accepted concepts. Say, already I said to you, say when we are looking for evidence-based concepts, we have to appraise certain articles. So that means what? We have to look in for some therapeutic guidelines or some research articles which are published in systematic reviews, or we can say in meta-analysis. Already in the last slide I was discussing you, right, isn't it? So that means with what are the main advantage of EBM is we can follow a standard guideline and create clinical protocols in accordance with global accepted concepts. It can, next we can say it can reduce the variations in patient care and assist with efficient and effective decision making. So which is very important concept of EBM, isn't it? It also ensures consistent focused care and better patient outcome. So now what are the other advantages? It provides a platform for both rural as well as urban healthcare institutions to provide the equivalent quality of healthcare to patients across a diverse geographical region. So this is one important advantage of EBM, I can say. So because usually, say for example, we always say that some socially economical poor patients will receive a, we can say a high quality medicine. That's what is prevalent. But when you adopt EBM, then whatever the thing which is being received for the urban will also be going for the rural regions. So that means what? EBM will provide a platform for both rural and urban healthcare institutions to provide equivalent, we can say, healthcare systems. Then the other advantage is it helps us stay cognizant of most recent trends and advances. As I said to you, EBM is always making us trendy. And then the other advantage is it inculcates a passion for continuous learning and self-improvement. Say always I say to students, say like they should have a continuous learning because every day is a learning day, including myself and everybody. So in that case, the EBM also says the same. It inculcates a passion for continuous learning and we can say self-improvement or self-knowledgeable person. And then it also creates awareness of research methodology and provides guidelines for further or we can say future research. So these are some advantages of EBM. See, when we have advantages, the other coin will be, side of the coin will be disadvantages. What are they? See, there is sometimes we can say lack of authenticity of the study or article. So it can lead to faulty guidelines getting implemented. So that is one major limitation we can say of EBM. So we should be a bit cautious here. Lack of cross-applicability of guidelines across various populations. Because say, for example, whatever is suitable in India cannot be suitable in the other countries, like for example, China or we can say Germany. So that means everything should be, yeah, we can adopt therapeutic guideline, but that should be personalized to the to meet out that particular population. So then it might solve. I'm saying some solutions for also this disadvantage. Validation in different groups may be, that's what I said to you, may be necessary prior to application of concept with confidence. That's what I said. In every population, set of population, we have to apply this concept and then we can say implement in patient care. And then we can talk about like lack of resources in the local context to adopt recommended guidelines. So this is also one important limitation or disadvantage. Then the other one is like risk of any new research finding to be debunked by a later study. See, what science is always, a bit tricky. Whatever results comes yesterday will be what I say debunked, or we can be outshaded by the next result of that another day. So final thing is what we have to, that's what I'm saying, critically analyze which is the best, and we have to choose and we have to implement in the patient care. Okay, so these are some disadvantages. And again, so let's see what are the barriers in, we can say, the implementation or execution of EBM now. So far we have seen the advantages and disadvantages. So now what are the barriers? Healthcare providers are not accustomed to the practice of evidence-based medicines. Sometimes it's true because of, you can say, they lack time. So in that case, they might not be trendy or they might not have time to, look into the things. And this is especially true with senior personnels who might find moving away from their accepted style of practice and adopting to a trendy concept. So I'm not blaming seniors. Seniors are to be respected always. So that is my, foremost statement. But sometimes the senior persons, what is the major disadvantages? They use only their clinical expertise. In the sense, they don't see the trendy concept. That is what is the major thing. So they have to see also the trendy concept, which is, of course, it is a challenging thing. Then the lack of knowledge on how to obtain guidelines on what is the recent updates or evidence. So always we have to check out which is the recent updated guideline. So always I also say to the students, don't buy Tripathi, what I say, 5th edition or 6th edition. What is the use? Now this almost the 7th edition is in use and the next edition is under process. That means every 5 years science is changing. Whatever been which I have studied in the 2nd or 3rd version in my UG PG days is not true now. That means all the concepts are changing. That's what is the major thing of EBM. So that means we have to update ourselves. So it's another challenge. So for everything, for our mobiles, for our laptops, everything requires, the updates. Goes on updating versions, isn't it? So that means here also in the EBM concept also it requires updates, constant updates, and which is essential for making some decision science things. And this is also one important thing. Nowadays, so many sciences are collaborated. Ours is like, for example, allopathy. So other fields of medicines are there, Unani, homeopathy, Siddha, so many other virtues are there, which are having good concepts. So nowadays we have to conglomerate, we have to fuse all the good aspects of all the medicines. But there again, sometimes the implementation of evidence-based medicine might be initially difficult, but later it will pick up. So the friction might come down. So the other barriers which I can say to you people is the continued development of more efficient and rapid ways of disseminating evidence and guidelines. Now, one more thing which I wanted to say is, see, the problem is for multi-morbidity problems or the person's having so many comorbidities. How will you generalize all the therapeutic guidelines in one patient? That means that is again a barrier in implementation of evidence-based medicine. So this is one important thing, especially in persons having comorbid conditions. In that case, EBM implementation can be a bit challenging. Next thing which I wanted to say is like individuals respond differently to therapy in clinical outcomes. So compared with the average responses during clinical trials, if this is what I'm talking about, especially now the COVID crisis. So vaccines development has taken a long way, isn't it? So first it has been under the trial process. In that case, what has happened now, whatever in the trial might not be, reflecting the general population, because we are now applying these vaccines for a wider range of population. Might be some peculiar reactions might come in, which we have to constantly wait and watch. Isn't it? So that means, so that is also there when we implement EBM, especially for example, the COVID situation, there again, we have to wait and watch, okay, especially in the aging population or the, as I already said to you, persons or patients having comorbidity. So once these paradigms are pooled with virtues of EBM, next, definitely I can say the next 25 years will be successfully spent. So these are some barriers of implementation of EBM, but it's easy when we all unite together and make some conglomeration, and especially with different fields of medicine and with different field experts, we can solve this issue very easily, and the next 25 years will be very, very successful. So now, to put in short, like what are the barriers in EBP? So like, for example, that's what I'm said to you, whatever I've summarized, let me do it again. Lack of value for research in practice, struggle in bringing change, because see, change is inevitable, but that has to be followed. It has to be accepted. Lack of administrative support. Sometimes the management, the hospital side, they might not accept it, but the higher officials, especially in the PATC. I have been a PATC member. I will be, as a clinical pharmacist, I will be emphasizing the importance of EBM in any particular hospital setup, wherein, because everybody is going to get benefits, especially the patients. So lack of knowledge mentors. So again, we have to train so many people in the field of evidence-based medicine so that they can share their knowledge and develop the budding, we can say, the professionals. And then the lack of time for research. Of course, this is a very million-dollar question, but we have to afford some time. Lack of knowledge about research. See, some doctors, especially, for example, they are experts in clinical side, but they don't have adequate time for research. So my probably what to say, my simple advice is, if they also involve in research, they are the, we can say the round the, we can say overall, we can say the best professional, I can say. And then the research reports are also not available easily. So sometimes, we have to access the journals, which are very, very costly. Subscription costs are very, very, very high. So in that case, that can be a limiting factor. But of course, the management can support this and what to say, subscribe certain things and to benefit the all the healthcare providers, so that they can get knowledge from there and share to the others. And then the complexity of research reports, because reading research reports is very, very tough. So we have to get what is the idea behind it. So we have to, get the best of things, and then we have to implement it. And then finally, we can say the lack of knowledge about EBP, evidence-based practice. So these are some barriers which I can summarize. All right. Now, see, now what I wanted to share with you is now here, like what are the factors that plagiarize, we can say, the healthcare research community. So here I want to share certain article. That's what I said to you. Evidence-based medicine itself is reading articles. Now I want to share one article which was published in 2005. See, Dr. John Lonandes. All right, so he published an article in PLOS Medicine called "Why Most Published Research Findings Are False." So this is quite interesting. So only I wanted to focus it to you. There are some publication bias. Say, for example, it's particularly true when the researchers find that an intervention had little or no effect, they're hesitant to publish negative findings. This is always true. Sometimes, people are hesitant to share the negative results. So only I always advise to my research students also, never hesitate to publish negative findings, because it might be useful to the science later who are in the same research area. So never hesitate to publish negative findings. So here again I am re-emphasizing. Next, overconfidence of the studies that rely on statistical p-values of that magical value 0.05 results in false positives as well as false negatives. So let us not more focus on this p-value of 0.05, which is a magical number and it might be sometimes tricky. Next, lack of replication. See, whatever I'm able to do, sometimes you may be not able to do in your setup. So that's what we're talking about, lack of replication. Next, small study size and underpowered methodology. Sometimes research is very costly. And so that means, the study sample size should be adequate to support the strength of the study. Next, selective outcome reporting, manipulation of the data, fraud, and financial conflicts of interest. All this also some, we can say, factors that plagiarize, we can say, the healthcare research community. And then the next one is, the greater the flexibility in designing studies and definitions, the less likely is the research findings are to be true. So this is also a very true statement. Next, the reward systems has to be encouraged, especially say, for example, nowadays, every organization is going for NAC, so many accreditations. So that means research and publications is very, very important these days. That means the management has to, support the faculty by encouraging them. Like, for example, they can give some award systems or reward systems, so that they or some incentives wherein the students or the faculty, everybody will involve in the research. Next, he concludes that a large part of evidence that the healthcare providers come to rely on, including major foundation studies used to treat patients, are frequently misleading, exaggerated, and often flat out wrong. So this is one interesting finding of Dr. John Lonandes, which he published in an article, Why Most Published Research Findings Are False, especially in 2005. So which is true even now. See, now, what are the challenges then? See, for example, again, so the same research team have published another article also. So in JAMA in 2014, which again I wanted to share with you. Here again, see what is the main thing, viewpoints is a small number of reanalysis of RCTs, that is randomized control trials, have been published to it. So that means what? The number of RCTs which are published are very, very, very less. Only a few were conducted by entirely independent authors. And 35% of the published reanalysis led to changes, and then the findings that implied conclusion different from those of the original article. So that's what I said to you, replication or reproducibility is sometimes difficult or challenging. So these are some challenges I can say. And now, when there are challenges, should be also some solutions. So in a 2014 JAMA article, again the same author, Learnandus returns to add suggestions for additional solutions. So by particularly in regards to changing the reward system, what he says is list of reward criteria or principles. He's saying like to help appraise, identify desirable research methods. So that the he's asking us to adopt this thing that is called PQRST alphabetically. There is productivity, quality, reproducibility, shareability, and translatability. So all this should be implemented so that the EBM concept can flourish. So that's what we're talking about. You can go through this. Again, I repeat, PQRST, that is productivity, the quality, the reproducibility, shareability, and translatability. So if you are implementing all these things, then the research, we can say, especially the health research, will improve a lot, tremendously, we can say. So now, what are the learner center problems in learning EBM? So this is also very important. Okay, we are ready to teach, but what are the problems that will be faced by the learners? Now let's see one thing, like lack of suboptimal role models. Of course, EBM itself a new concept. So wherein the role models, the number of role models available will also be naturally less. So in every organization, we can say the numbers is quite less. So that means lack of suboptimal role models. And then we can say lack of clinical context, that is the materials. Then the lack of students' difficulty, we can say mastering EBM skills. So it's all comes by practice. But sometimes, people, they come out of that practice habits. Then they might find difficulty in implementing EBM or learning EBM. Then lack of time, as I said to you from the beginning. So that is one important thing. But again, whatever the problems which I have are addressed, I'm always trying to give some solutions also. Say first thing, early incorporating of clinical content into EBM training. Say for example, in the syllabus itself or in the curriculum itself, we can include, say in the form of, say for example, EBM lectures, small group discussions, capstone assignments. All this can be tried out so that the EBM concept can flourish in a particular education organization, or we can say the hospital education organization together. And then can rope in all physicians who can also play an optimal role models in their approaches to EBM. Always see the physicians are our, we can say, friends, counterparts who can be invited. I always invite many physicians for guest lectures so that they will also give their inputs. Pharmacists will address in a different angle. They are drug experts, but physicians are expertise in the clinical side also. So I always invite physicians here, again, especially in the EBM practice. In my career, several successive presentations of EBM concepts have different levels of complexity. That means so that each exposure builds on the prior exposure. That means that's what I'm saying. When we learn, say for example, when we our first steps of walking. Hope you remember how many times you would have fallen. Did you know the count? Did anyone felt that I'm so many times I've fallen? Will I walk or not? Nobody. Because it's a learning experience, and they now they are walking. Like my same thing. Initially, there will be a lot of struggles, but later, when you implement and you start practicing the EBM concepts, it will become easier. And what are the other things? That's what I'm saying. We can talk about the faculty development program, especially concentrating on EBM. Say, for example, bolstering the faculty EBM skill. However, the organization, that faculty can be, or younger faculty can be trained very well in the concept so that they can take these things to the students. And then say remedial education strategies also should be implemented so that we should produce assured, knowledgeable, and competent budding millennial healthcare providers. Hope all are million, we can say, healthcare providers. So evidence-based medicine concept should be very, very important, and so that we can achieve the desired clinical outcome, especially in the patients. So now, okay, so we have talked so many things about EBM. Like, what are the things we have talked about? What is EBM? What is EBP? What is how we are going to? What are the needs for EBM? What are the advantages? What are the disadvantages? How to implement? What are the challenges? What are the barriers? Everything we have given solutions. Okay, but now I want to focus on one important thing, because we are all clinical pharmacists or budding clinical pharmacists in the future, isn't it? So now, what we should feel proud. I can say we can lift up our collar and say, like, pharmacists are going to be an inevitable healthcare team member, especially in evidence-based practice. Why? Physicians, due to their multitasking, have time constraints to update and implement the, we can say, the recent or trendy achievements or advancements in the practice on daily basis. Here comes the pharmacist, a trusted source of objective medical information who can fill in this void and help physicians abreast with recent trends and advance medicine to achieve the desired clinical outcome. Because pharmacists can act as a liaison, that is connecting link between the patient and we can say the physicians. So clinical pharmacists have numerous roles which they can play. And so many organizations, for example, I've trained in Apollo and all. So now they're outshining in their career, and all the healthcare providers are appreciating the services rendered or provided by the clinical pharmacists. Hope this message goes to every budding clinical pharmacist. So be confident, have trust in yourself, learn every day, learn from your teachers. Teachers are gurus, they'll respect them, learn good things from them so that you can implement the good things in your career also. So now, to conclude, EBM is a systematic approach to clinical problem solving, which allows the integration of the best available research evidences with clinical expertise and patient values. EBM stepwise approach is meant to assist or replace entirely the clinical decision making required to meet individual patient needs. That's what I said, customized individual patient care therapy. EBM must become an essential component in the academia. That's what I'm talking about in the education institutions of budding healthcare providers to distinguish the significance of critical thinking, statistical reasoning, and continuous evaluation of clinical practice. So this is very, very important. And then we are talking about evidence-based care is a lifelong approach. So that means, as I said to you, learning is a lifelong process. Especially here, it's very essential for clinical decision-making and for bringing out excellence in practice. Barriers, which I have already discussed in my slides, which create a gap between clinical research and clinical practice, and new knowledge and its implementation have to be addressed effectively to make progress in establishing individualized patient care. So this is very, very important. The need of the hour is that EBM should recognize multiple dimensions and modalities of knowledge, including basic scientific physiological theory, practice, we can say expertise, and ethical standards. One must continue to incorporate joint decision making. So this is very, very important. And teamwork into clinical practice to safeguard the importance of individual patient cares or value. This measure would help both the healthcare providers to comprehend the complexities of real life clinical questions and deliver the most meaningful evidence in their daily practice. So we still have a long way to go. The good news is that the research and efforts are continuously improving. There is improving in EBM is ongoing process. So these are some, we can say, useful resources which you can go for evidence-based medicine always. To implement evidence-based practice, to learn. These resources will be very, 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 very useful to you all. There's some links which I've already provided to you. So these are my useful references which I've used for preparing this content. So hope you have understood. So thanks a lot for your patient hearing. Thank you. Thank you so much. Hello. Hello. Hi, sir. Hi, Mahai.
Yes, sir.
Hi, how are you people? All right, hope everybody understood what is EBM, what are the, we can say, the execution, what are the challenges, what are the barriers, and what are the solutions for implementing evidence-based practice. So hope you are all, at least the budding clinical pharmacists, have understood certain concepts today.
Yes, sir.
Yeah, good morning, sir. I'm a faculty of Kelly College of Pharmacy, Belgavi.
Can you be louder?
Is it okay, sir? Is it audible to you, sir?
Yeah, a bit okay. If you can increase your voice also.
Yeah. Good morning, sir.
Yeah, good morning.
This is Shashikala Wali from Kelly College of Pharmacy, Belgavi. It's in
Yeah,
Karnataka, sir.
Yeah,
Sir. Yeah, really, it was a wonderful discussion, sir, regarding the evidence-based medicine.
Thanks a lot.
Sir, can we can strengthen the EBM in team-based learning and problem-based learning, what you have discussed.
Yeah.
But it is quite difficult to do the team-based learning, sir. Yeah,
Yes,
we
ma'am.
understood that problem-based learning, sir. We tried
Yes.
also.
Yes.
But team-based, like how to go about the team-based, sir, learning process?
Yeah, ma'am, it's a very excellent question, ma'am. Thanks for asking this question. See, now we have to pull in all the stalwarts, especially from the clinical side, then from the pharmacy side, from the industry side, health sector side, everybody. All the experts can be, pulled up in one area, and we can, discuss that particular concept. Say, for example, like today, which we are doing today. So this online program is also one example for, you can say, the learning the EBM concepts. So in that case, that team has to be properly chosen. Say, for example, ma'am, we are choosing friends.
Yes, sir. Yes,
All are not our friends. All are not, we can say, our excellent friends. So that
Yes,
means
sir.
when we are forming the excellent network, there again, especially in your teamwork of where we are trying to implement evidence-based medicine, here also we choose stalwarts who will be, really sharing their inputs and ideas, and they'll be sharing their problems, how they solve, so that those problems can be solved, and then we can implement this in the particular, we can say, the setup. So it's quite challenging, but we can do. It's not that it's not possible at all. We can,
Yes, sir.
which I have tried in many of my organizations where we have worked, say, for example, Ramchandra or Acharya BM Reddy, especially in Bangalore, where I was working for 2 years, Nellore,
Okay, sir.
2 years. So I worked in so many, states, wherein I've seen the setups are different, of course. But when we speak, say, for example, when I conglomerate with the healthcare providers who understand me, who understand my concepts, they are very friendly, and they are very hardworking and trustworthy, and they have implemented evidence-based practice and in their health setup, ma'am. So it can be done. It can.
Yes, sir. Yes, sir. Yeah, definitely, we will try, sir. And problem-based learning, we have started we can give some trigger topic, and we can discuss more on that, and we are doing it, sir. It's quite interesting. Even students are well prepared for the. Yes, sir.
They love this session. Yeah, especially.
Yes, sir.
More than, see, I'm not saying lectures are monotonous. We can learn a lot from lectures. I've learned teachers. I've got a lot of respect for my teachers, but that is different. But today's trend is we have to add on some spices.
Yes, sir.
For example, now in this learning process also, we can go in for this, problem-based learning, all this, like online. Say, for example, this is a very, very good attempt on this. We should say indirectly, thanks to COVID crisis. Otherwise, we will not be able to meet in so many, online virtual classes, which is possible now. So I'm always, I'll be thinking of positives in even negative situations. So in even COVID situations, this, online virtual sessions are, very highly promising. So in that case, what I say is, whatever you are implementing, that PBL is very, very highly appreciable, ma'am. Please keep it up. So
sure, sir. Thank you, sir.
Students will really love you people, and the organization will get, highly reputation.
Yes, sir. And surely we will try to implement this team-based learning also, sir.
Sure, ma'am. Sure. We can implement, ma'am. So you can invite stalwarts from different healthcare fields, and can implement it.
Sir.
For example, cognitive means you can call it from experts from, cognitive field, so many things from some other.
Sure, sir.
So, and then you can implement it. Yeah.
One more thing, sir. Actually, this is out of this topic. I have heard your name. You are expert in TPN, sir. Is it true?
Yeah. TPN, ma'am.
Yes, sir.
Ma'am, to an extent, not so much, but implemented in my organization, like when I was working in prior organizations, I did try, to implement certain things, as I was a PATC member also. So it was possible for me. So my students are now they are posted as clinical pharmacists in particular organization, because that was the first batch wherein I was struggling to, put my students in TPN as well as in clinical pharmacist employment in that particular organization. So
okay, sir.
Successful. And now, even now, the same students, I can say, are accepted in that particular organization, which I strongly believe in, because our organization should believe us first.
Yes, sir.
Like,
Because I heard,
Yeah.
sir, like you are expert in the TPN.
Yeah.
So
Yeah.
actually, I wanted to go about like more of TPN services in our hospital. Also, we have started, sir.
Yeah,
So
ma'am.
if in our future, like we need any help from you, definitely I'll contact you, sir.
Sure, ma'am. Sure. Sure.
Okay, sir.
So
Thank you very
my
much,
wife is
sir.
also working in pharmacy practice only. Now she's also implementing. She might be also of very great help to you. So we'll be in touch
Sure,
with.
sir. Sure, sir.
Thanks a
Definitely,
lot,
sir.
ma'am. Thank you so much, ma'am.
Thank you
Have
very
a
much,
great
sir.
day.
Yeah, thank you very much, sir.
Thank you, ma'am.
Yeah.
Thank you, sir. And there are few questions from the participants, sir.
Please.
What's the difference between research and evidence-based practice?
Can you repeat because voice is not clear, ma?
Okay, sir. What's the difference between research and evidence-based practice?
No, I didn't get the first one. Evidence-based practice I got. What is the difference between
Research.
research?
Yes, sir.
Research.
Yes, sir.
Okay, research and evidence-based practice. You mean correct?
Yes, sir.
See, research is and evidence-based practice itself is coming under research only. You can say. So all these things, for example, without implementing EBM in what to say our study curriculum, we will not be able to do project works or like for example any PhD thesis. In that case, EBM itself is under research only. That's what I can say. So there should not be much difference between these two.
Yes, sir.
EBM concept itself is evolving, you can say, from researchers. Guidelines and all, which they formulated for many pathological conditions, have been coming from or originated from research articles only.
There's another question, sir. Do
Yeah,
we
yeah.
have adequate scholarship and resources in India by government? Sponsorship and resources.
Scholarship for?
Sponsorship and resources in India by government.
Sorry, your voice is echoing. I'm not.
Do
Hello.
we have adequate sponsorship and resources in India by the government?
Like scholarships in India, you mean?
Sponsorships, yes, sir.
Sir, the question is, do we have sponsorship?
Yeah.
From the government?
Yeah. Okay. Yes, it's there, but the thing is, that's what I'm saying. It's very difficult. Those who are in what is the senior professors and teachers, they will be knowing the difficulty to acquire funds and sponsorship. Especially, see, yours is also a AICTE sponsored workshop, isn't it? So, I'm salute these people for working out so many formulas to get this AICTE fund. So, how much people you would have struggled. Same way, scholarships and we can say the funds are available for implementing this EBM also. But only thing we have to search. But with the stalwarts, especially the senior professors or the HODs or the principals, they might be in a position probably to get those nuances to get these funds. As you succeeded now, right? So you are getting that you got this the fund for this organizing this great workshop. I really congratulate all the people. So a loud of applause, you can say. So we can say the same way you can also get scholarships for this implementing this EBM practice in your setup or hospital organizations. You can. Then any other questions?
Yes, sir. Any training in critical appraisal?
Sir, can you please, your voice is very clear, sir.
Yes, sir. Sir, is there any training or critical appraisal?
No, sir, like this kind of workshop. Say, for example, you people keep on watching, no, in your conferences or in your Google things, workshops. You people can have, say, sometimes the workshops on EBM. So please go and attend that. Then it will be, add up in your, it will be a feather definitely in your cap, in your professional career. So keep watching. That's what I said, keep be trendy, not only in mobiles, in terms of education.
Thank you, sir.
Be trendy. So keep on the conference, seminars, workshops, which is on EBM. Then you people will get lots of conference. Any other questions, sir?
Yes, sir.
Yeah.
How big is the amount of successful medical treatments based on evidence?
Sir, can you please repeat it, sir?
How big is the amount of successful medical treatments based on evidence?
Hey, I'm sorry. Yeah. Sir, can you take that question and repeat to me?
Yes, sir.
Because your voice is very clear, sir.
How big? So yes, sir. Can you hear me now, sir?
Yeah. Yes, sir. I'm hearing your voice clearly,
Yes, sir. So how big is the amount of successful medical treatments based on evidence?
No. See, when you implement evidence-based medicine, it is the best, we can say, the therapy which is now rendered to the patients. So the patient care is individualized and we can say highly optimized. So the success rate will be very, very, very huge, I can say. When you're in, say, for example, I'm saying each organization in, say, for example, in cardiology or oncology, they have their own therapeutic guidelines. So as a PATC member, we have also given, say, for example, we have help in formulating guidelines that suiting that particular hospital. In that case, when you make or when you frame a therapeutic guideline for yourself, that is your own organization, then you can implement that in your patient care, which will be very, 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 I can say to you, successful, highly promising, which I have seen in many organizations. So that is the success rate of evidence-based practice, I can say. Though it might be initially a struggle, later it will be like a cakewalk. So you can achieve. And the patients, you can see literally, you can see the cure rate is high, the morbidity and mortality rate will come down. So in every hospital, they will have that mortality rate. When you start implementing evidence-based practice or implementing therapeutic guidelines, because when you implement therapeutic guidelines of your own, that means you're implementing your evidence-based practice there. That means it's individualized. That means your success rate is for 100%. Why 100%? 200%, it is guaranteed. Then the patients will come to your hospital setup only, mouth-to-mouth propaganda. I don't want to brand names certain organizations, say ABC and all. Whatever organization which you are working in, if you are a part and parcel of some evidence-based practice, if you are implementing it with great difficulty, you will see the success for sure.
Thank you so much, sir, for taking time out of your busy day for us. Now we'll have closing remarks by Dr. Santosh Kumar.
So thank you, sir, once again.
Can you repeat?
Yes, sir. Thank you, sir, once again for your great speech. The way you compile the entire EBM, this execution barriers of this data, I think it's really thought-provoking by using your, certain mnemonics you have used in the presentation. Like the way you compile the data is really thought-provoking for all of us.
Thank you, sir. Thank you so much.
So much of this from. Thank you so much, sir.
Thank you so much, sir. Sir, Bapiraj, sir, thank you for inviting me as a resource person. Regards to all of you, Principal, Vishnu College Management, everybody. So thanks a million. And again, heartiest congratulations for arranging this beautiful workshop. So I know how much people you have worked hard behind this thing. So wish you all the best, sir. Wish you all the best. So hearty congratulations. So I know the difficulties. So it's a feather to your cap again. So it's a super great, sir. Great.
Thank you, sir.
Thank you, sir. Thank you so much. Thank you so much.
Sir, thank you for your time and your valuable.
Thank you, sir. Thank you, sir. It was a pleasure talking to you people.
Thank you, sir.
Bye, sir.
Bye.
Bye to all. Bye to all. Regards to all. Happy professional, we can say, days ahead. Thank you so much.
Thank you, sir. Thank you.
Bye, sir. Bye.
Bye, sir.